The chamber got this idea just 3 days ago when we heard the announcement by the chair of CARICOM, the Honorable Prime Minister of Barbados, Mia Motley, referred to a single domestic space in CARICOM as she was announcing the CARICOM heads meeting. And indeed, that struck us quite forcibly and led us to the firm belief that this crisis really could not be left to just the individual member states, but there must be some level of collective and collaborative action on the part of the region as a single domestic space. And so it's against that backdrop that very quickly we put this together, and I want to thank the panelists for agreeing to participate at such short notice. Next, I think we want to pay, to extend our condolences to the relatives of all those from the region, in the region, and across the world who've lost loved ones as a result of this virus. Send to them our deepest sympathies. Also, I think it would be remiss of us if we didn't pay tribute to the healthcare workers, the nurses, the doctors, the porters, the pharmacists, and all those who work wherever they may be to help save lives at this time. And so we thank them for their service and wish them the best as they continue to serve humankind. The chamber is of the view that no one event, no one meeting can provide a solution to the problem, particularly a crisis such as this one. But we felt that a good start would be to have a discussion with key stakeholders, so that we can start a discussion and perhaps come up with some recommendations and so on as to how best the region collectively might be able to deal with this. And it's against that backdrop that I want to start off and ask Dr. Richard Van West Charles, a former Minister of Health, Public Health in Guyana, former PAHO official that has served in the region, in Bahamas and Jamaica, representing PAHO in other countries, to give us his perspective from the medical background of the current situation.
Thank you very much, Wesley, for having me on the panel, fellow panelists, ladies and gentlemen, citizens of the region. I think this is an important topic for us to possibly discuss and dilate on. I think as we look at our televisions today or hear our reports from the radios and hear from our friends and colleagues, we pay attention to the numbers of COVID-19, the numbers of cases and the number of deaths, globally, regionally, nationally. We begin to feel the impact of COVID on the development at a regional level, at a national level. As businesses close, there's a downturn, economic and human activity in our respective countries within this domestic space. So the health development paradigm is affected, and it is a paradigm which we have not fully embraced. Many actors are now calling for the involvement of all sectors as a solution to the problem. But since the declaration of Alma-Ata in 1976, WHO had called upon us to embrace health as an intersectoral issue for sustainable development. Now, what is the situation in CARICOM as a result of COVID? The impact in CARICOM today, let me say globally, there are about 2,074,529 cases. If we were to remove the Dominican Republic, Puerto Rico, Martinique, Cuba, and Guadeloupe, we have in CARICOM about 1,112 cases with 62 deaths. We do know that from the public health strategic directions, that to break transmission, hand washing with soap, social and physical distancing, the issue of isolation, quarantine are very, very critical. But important of all is to understand the distribution of the virus in our societies. We know that we now have, it is no longer a matter of imported cases in the Caribbean. We now have local transmission occurring in all of our countries, save except one or two. We know that, therefore, the social distancing and hand washing becomes critical in terms of the barrier methods. We have seen from China, Italy, Spain, and New York, how fast transmission has occurred. We know that 80% of the cases are either have mild or moderate symptoms, but 20% of the cases require hospitalization or some intervention by the healthcare system. And in many countries, a high case fatality rate of 3 or over 3%, especially linked to the high-risk groups of the elderly and those with underlying morbid conditions. So what have we got to do? We've got to really embrace the 3 T's: test, trace, and treat. And how prepared are we in the Caribbean? Testing and tracing, quarantine and isolation. I think we've learned that the faster transmission is based on testing, isolate, and treatment. But it seems to me that we have not optimally utilized all of the resources in the Caribbean with respect to testing. We have not moved as fast as we should across all of the countries in the Caribbean with respect to testing. When I said earlier, we need to understand the distribution of the virus within our society. And the only way we can know that is by testing. This brings us to the point, and by testing and in the involvement, not using singularly the public sector resources, but I think it is required, for me it's a sine qua non, the involvement of the private sector, not only the private sector laboratories, the private sector healthcare facilities, the involvement of private physicians in an integrated way to deal with this matter. Because we have to see this as a public good for this domestic space. When we look at, many people are now talking about normalcy and how we get back to normalcy. And I think one important aspect is to understand how the transmission is taking place in our societies. And unless we can ramp up testing, we are unable. If we attempt to reopen without an understanding of the distribution of the virus in our societies, we make a serious mistake. So we must understand and we must ensure that the transmission of the virus is controlled. We must understand that the health system has the capacity to detect, to test, isolate, and treat, especially in a domestic space that is dependent on tourism. Because if the space were to open up, then you must have the capacity to detect and test, and the test results must be able to be returned within 24 hours or less. Because this would impact economically and create problems for the system. Outbreak risks are to be minimized. Preventative measures as you open up in different places, in the private sector, in the public sector, there needs to be an understanding as to what has to be continued with respect to social distancing, with respect to hand washing. These are practices that have got to be embraced and inculcated as we move forward if we are going to reopen and get back to normalcy. We cannot assume by opening up, we drop our guard and then we are not embracing the issues of washing our hands with soap frequently, engaging in the social and physical distancing, etc. And at the same time, the health system, the epidemiological systems in our member states must have the readiness to be able to detect, to be able to trace, to be able to test and give responses very, very quickly. As people come in, we've got to monitor people coming in and understand where the virus is moving external to our domestic space. And we have to ensure that the communities within our countries are educated and understand and are empowered to act. I think important for schools is the institutionalization of these public health practices, the behaviors, and in many of the communities. So in order for us to get back to normalcy, I think understanding how the distribution of the virus in the society and how controlled the transmission is critical for us to be able to say, yes, we can reopen. For a space that is linked to tourism, it is probably a bigger challenge as we open up and as people are going to be coming in. So we have to be monitoring our ports as islands, as mainland states. We have borders. We have to be monitoring. The mainland states have got to be monitoring the borders. And the islands have got to be monitoring how people are coming in through the unofficial ports within the system. And the continued checking, working with the hotels and the hotel industry in terms as we did in the past for the control of diarrheal diseases. So we must put all of these together before we can ensure that we can reopen and get back to a state of normalcy. I will stop at this point, Wesley.
Okay, thank you very much, Dr. Van Miscard, for what I would call the medical overview. And I'd like to turn now to Dr. Slater. Dr. Slater is the Assistant Secretary General of the Caribbean Community at the Caribbean Community Secretariat in Georgetown, Guyana. Dr. Slater, the heads of government met virtually, I think, on Wednesday past. Could you give us an overview of what were some of the strategic decisions taken in terms of how the region might best collectively fight this virus and confront this crisis?
Thank you, and good afternoon to panelists and to the viewing public. I join with Dr. Van Miscard in commending the organizers for this very important, in fact, a vital activity as we discuss the impacts of COVID on our region. And it seems to me as if we are at a phase where we have to start to plan for reinvigoration and reopening of our economies. Now, Dr. Van Miscard has given an outline regarding the medical conditions that might be required to move forward. I just want quickly to give an update of what has been happening at the regional level. So, quickly, from January, the region has been engaged in this. We have been monitoring at all levels. At the political level, the chair of conference, Prime Minister Motley, was advised and has been almost on a daily basis in contact with the various regional institutions coordinated by the Secretary General, Ambassador Owen at CARICOM. And as you know, we have a range of regional institutions, and we have had them meeting. We have had different councils of ministers meeting, going through the various steps. This culminated on Wednesday at the last special meeting convene